Differences between a closed and open rhinoplasty. So when it comes to rhinoplasty, there's two general approaches of how we perform the procedure. One is through an external or an open approach, and the other is through a closed or an endonasal approach. And the difference is that with an external approach, we're making an incision here, and the rest are inside the nostrils, and lifting the skin up to be able to do the work on the underlying cartilage and bone. Whereas an endonasal or closed approach, the incisions are all on the inside of the nostrils to try to accomplish the changes we're trying to make on the cartilage and bone. The choice of which is determined based upon your surgeon's preference and comfort with each technique and what they think they can accomplish with each technique. So for a crooked nose that requires significant cartilage grafting or a revision case, I tend to use an external approach. But for a primary rhinoplasty in which I'm trying to accomplish some tip work, maybe some refinement of the bridge or hump, I may do that through a closed approach. So I generally perform about 60% of my rhinoplasties in an external approach and about 40% in an endonasal or closed approach. Both heal beautifully, and one has a slight external incision, but it's barely visible. I think it heals very nicely. So I don't think that you should necessarily use the approach to determine the type of rhinoplasty you want. I think you should let the surgeon decide based on what they feel comfortable doing for your particular needs.